Understanding depression. Everyone experiences some bouts of sadness in everyday life. This is normal and typical for all people to experience it at one point or another. Feeling depressed is different than being depressed or being in a depressed state. It goes well beyond the scope of just feeling blue. Depression impacts greatly on a person and family members, affecting many areas. If left untreated, it could be devastating. The sooner it is addressed, the less impact it will have on life areas. There are different types of depression a person may experience. Each one carries its own set of symptoms. Some symptoms of one type of depression may overlap with another type of depression. It is usually a cluster of symptoms that distinguish one type of depression from another. Depressive symptoms could vary from person to person as well. One person may be presenting symptoms differently than someone else. Intensity could also vary from person to person. What makes a diagnosis more challenging to make is when we have another diagnosis coexist with depression. Individuals may be struggling with more than one disorder. Furthermore, one emotional state may create another emotional state. For instance, an extremely anxious person may feel depressed over their anxiety, as it could be creating a feeling of helplessness for them. What causes depression? A combination of factors or a single factor could influence a depressive episode. Those who have a family history of depression are more prone to having it. Depression is more common among women than men. Some of the influencing factors could be attributed to hormonal changes, postpartum issues, and menopause. Men experience depression differently than women. They may turn to alcohol or drugs when they are depressed. Furthermore, they may present their symptoms in a more physical way, such as anger or reckless behavior. Children and teens are not verbally expressive about the emotions they're experiencing. Their feelings may be acted out through behavior. Others could see depression in a youth prior to them verbalizing their depressive state. Influencing factors in a youth or adolescent experiencing depression would include hormonal changes, peer interactions, and gender issues. Elderly experience depression due to a lot of factors beyond their control. They as well may not show outwardly signs of depression. An important factor to consider is distinguishing between grief issues and depression. Grief could turn to depression, but is usually confined to emotions associated with the loss. There are different treatments as well as treatment approaches. The two most common approaches are talk therapy and medication. Keep in mind, these aren't the only two, but most commonly used. Also, it does not have to be a choice of one over the other. A person could do one, the other, or both. If an individual decides to go the medication route, there are different types of medication out there. Each class works differently to alter the brain chemicals. Keep in mind that only certain types of professionals can prescribe medication. These professionals will base their decisions of which type of medication they prescribe based on their own professional experiences. If you choose the medication route, there will need to be close monitoring with a professional. Side effects as well as effectiveness will be monitored. It is not unusual for changes to be made in dosages and/or medication especially in the beginning. Talk therapy is also used to address depression. There are various forms of talk therapy or psychotherapy. The two more popular ones are cognitive behavioral therapy and psychoanalysis. Each one has their own variations and forms within itself. The types or modalities of treatment could vary as well. An individual could be involved in one, the other, or a combination of types depending on their problem. For some, more intensive services may be required. The least restrictive is 1 time a week individual. The most restrictive would be an inpatient setting. Inpatient is for more serious situations. Professionals usually start at the least restrictive setting and would step up level of care if needed. Once symptoms are stabilized, a transition to a less restrictive level of care is planned. Other forms of therapy can be used when the traditional therapy approaches are no longer effective. They are not the first course of treatment recommended. The choices available for types of therapy, modality, medication or not, and settings for therapy could be pretty overwhelming. Start at the least restrictive, a doctor or a therapist. He or she will be able to guide you through the recovery process, or at least get you at a starting point. Recovering from depression can be a lifelong pursuit for some. Changes in type of treatment, medication, and even modalities are not unusual. There may be one journey to recovery, but many roads to get there.